Hello, everyone. Thank you very much for joining today's pitching session. Very happy to be here today with Christoph and Sophia uh, from Brainhero. You've known Brainhero. I think Christoph, when was the first time we worked there? 2022.
Yeah.
So already, I think 3 years have almost 3 years have passed since then. A lot of great things happened since then. I remember in 2022 when we did the first round. I think that we reached the target in like some few hours, and then it was oversubscribed already 2 times. So very excited to had done that previous campaign a couple of years back, and excited to see you guys again. Back in on Seedlink, and very excited to hear about the updates of what you've been doing over the past few years. So I would suggest just tell us a bit about, I think for those of you the investors that don't know you, to tell us a bit about what you're doing and how you started with Brainhero, and then to go through the deck, and we'll also have some questions and answer in the second part of today's pitch.
All right. Okay. Yeah, then I make a start. Yeah, I'm Christoph, founded Brainhero, and yeah, most importantly, also I'm a father of a daughter with autism, so this is how it all started. But I will tell you later on what happened. And yeah, Brainhero is a neurofeedback therapy that the company founded late 2018. We are a medical device company. At the time when we had the first investment, we had passed some first quality management systems, but we didn't pass the MDR yet. So that was kind of close by. My background, I'm originally from Germany. I live in Vienna. I studied computer science and business administration. I'm 52 years old and or young, whatever you call it. Used to I live in Vienna now for more than 20 years. Did before worked in London and basically international areas. So I worked at IBM. So very technical stuff, not really um, medical device and neurotechnology. This is really all that I gathered when my daughter was diagnosed with autism, actually almost 14 years ago. Yeah.
All right. Well, thank you, Krista, for the introduction. Sophia, can you also introduce yourself a bit, and then we could go through.
Yes, yes, of course. I'll keep it short. I actually joined a year ago, a little bit more than a year ago, Brain Hero. And right now, my main focus point is connecting therapists to the solutions that we offer. So I'm representing the marketing and communication side of also business development of Brain Hero.
Thank you so much,
Happy to be here.
Krista. The floor is yours.
All right. Let me share what I have. Second. Right. Right. As I said, I'm Christoph. I'm the founder of Brainhero, and I'm also the father of a wonderful daughter with autism. I lived through the struggle firsthand. So how hard is it to access therapy? How long waiting lists are? How helpless it feels when nothing seems to work? And that's the reality of thousands of families. So while searching for options, we stumbled across a technology called neurofeedback. Not because it was trendy, but because we were willing to try anything at that time. So just like I once tried with my daughter, some kind of dairy-free diet. And what we discovered was unexpected. The effects we saw in our daughter were much stronger and broader than what the research had suggested. And that moment, that was actually, yeah, it was kind of summer 2018. That moment changed everything. And so back in 2018, we founded Brainhero. So it was actually by the end of that year when we founded Brainhero, after we experienced some other tests with parent self-help groups and other parents being affected with those children, and so this is Brainhero. 1 second. So Brainhero is a certified Class 2A medical device that consists of a clinical-grade EEG headset and a tablet-based game that delivers neurofeedback training at home. It's intuitive, it's child-friendly, and it requires no professional supervision. What makes it special is the algorithm, which mimics the logic of a therapist-guided training. We even filed a patent for that approach because it allows us to replace manual therapy with a digital system that is efficient, scalable, and affordable. But it's not just the hardware and the game. We built an entire ecosystem around it. So we have a remote access dashboard, we have a standardized psychometric test that we perform in the beginning of the therapy, in the middle, and in the end. And we have real-time progress monitoring, and we continue to collect data for ongoing optimization. So for instance, we learned that symptoms with ADHD are better treated when you do daily training, while symptoms in autism are trained every second day. So this data-driven approach allows us to tailor the experience for every child and to measure what truly works. We already seen strong clinical effects. So far we have experience on around 200 children. So in autism, we observed better social interaction, improved emotional regulation, and fewer repetitive behavior. And also, it also triggers the mirror neurons. So when you have those children, they learn much quicker than through observations when Brainhero was used. In ADHD, so the children, they show increased focus, reduced hyperactivity, and also they're better in impulsive control behavior. And that impact goes beyond metrics. So in our family, it means that my daughter was then able to really go into traffic, so cross streets on her own. She can go to supermarkets on her own, and it's really a change for everyday life, and the whole life becomes more manageable, and that's really everything. So these are on that map our current partners. And as you see, we are currently on the market in Germany and Austria. And we are using now clinics and therapists across Germany and Austria to access the market. So since October, we've been actively expanding our new B2B2C model. And right now, we are about to onboard 12 new partners. So that map will change soon, significantly. And every partner can actually serve dozens of children within their region because they're doing this remotely and really very effectively. So every child that they are on board requires minimal effort, which is about an hour of care per month, and brings them additional revenue and additional benefits to bring to these children. So we are currently on a route to tackle 20,000 euros in MRR that will be hit by summer. We plan to reach 60,000 euros in MRR by the end of the year. And it basically works like when a clinic starts, they are starting with a few, 2-3 children to start with, so they get familiar with the system, and then they slowly progress. So basically every therapist or coach or clinic are basically growing step by step. So every partner on that list are growing step by step. And this is how we can grow organically. So the need is there, the waiting lists are there, and we see that about 10% of the children in Germany and Austria are affected by either autism or ADHD. The therapy is financed through a mix of, there is a private payment option, of course, but there's also a way to go through occupational therapy reimbursement. There are some private insurances who are doing this case by case. And we also have a lot of cases actually now going through youth welfare funding. So importantly, parents always, we learned a lot actually through these years. So we discovered that it's very important that the sum amount is still paid by the parents, because this contribution ensures that they really stay and they are not producing any dropouts. Because basically, if they have a therapy that doesn't cost them anything, they usually drop out. So that is our kind of experience we had over the last years. So this is our team. We are now really at the start of our scale-up phase. Our goal is to reach 1 million in ARR in 2026. And based on that current traction we have, we are confident to get there. We are currently in this bridge financing phase to support this growth. And we are also speaking with strategic partners to expand internationally and develop our next generation hardware that brings us also to other neurological issues. So beyond children, we're already receiving requests for adult ADHD support. And we're also preparing to extend like areas of anxiety or depression. So this is a typical thing where you can lend the symptoms of these neurological issues. So I hope you're interested, and if you really want to know more, there is a Q&A session now following. We secured most of our current round and would love to talk to you, and would like to see who's interested in taking part of our next step. Thank you.
Thank you so much, Christof, for the presentation. Can you tell us a bit about, how does the competitive landscape look like? Like what are the main barriers that you're facing when selling?
Well, in terms of competition, so that you kind of have to compensate basically what are the direct competitors, or you can basically say, okay, there is neurofeedback as a technology. Neurofeedback as a technology, there are competitors that are usually using very expensive equipment in very experienced therapy centers. They are approaching usually adults with maybe depression or anxiety. So this is not really currently our competition, but there will be in the future. But these sets are expensive. You go there usually once a week. And the impact that we are generating is because it's like a gym for your brain. So if you go to a gym once a week, so if you're a gym goer, you go once a week for an intensive training, you feel completely wrecked after this. And then in comparison, you go there at least 3 times a week or 4 times a week, and you have smaller amounts of training. So what is the better impact? The better impact is you have smaller sessions, more sessions. And this is exactly the difference that we're having against all of our competition. Medical neurofeedback currently is only very complicated. It's only in practices. It's only with a very expensive therapist sitting there, actually just doing some technology stuff. And you pay about 100 euros per session. And so that's the one area of competition that we see, okay? So this is kind of the neurofeedback market. If you go for the competition of doing kind of treatments for children with autism or ADHD, okay, there is a simple solution, or it seems to be a simple solution for children with ADHD. We give them drugs, okay? So there's a Ritalin. It has a lot of side effects. And basically what you do is these children are kind of, sleepy, getting really not very active. They don't learn self-control. They don't learn how to work with their different kind of brain. So for health insurance is an easy thing. Okay, we are a bit more expensive, of course, in this case, but for the parents, they hate it. And we see this across the board. So they come to us, no, we don't want to take drugs. We do this the proper way because we want to learn that these children learn how to use their brain properly, because these children are usually very smart, very intelligent, and they have a lot of beauty in there. If you go for autism, there is no neurofeedback for autism. The autism world is totally crazy because usually all the centers in Germany and Austria, they have waiting lists. The longest waiting list I had so far is in Hamburg. It's about 3 years waiting for therapy. And you have before you go for a diagnosis, you wait 2 years. So it's really a madness in terms of that the care is not there. It's not provided. the typical health system is not dealing with this properly. So there is actually really a demand, not really a competition in this field for us.
Understood. And can you walk us also a bit through the business model and the unit economics that your guys are operating on?
Yeah. Okay. 1 second. I'll give you a slide for this. Yeah. Right. So this is a way how we worked until October last year. So we did the direct approach B2C, which was also German and Austria, but we learned that because we have a physical device, so this is how it looks, by the way, but this is the box where we get it in. We have a physical device, we have a technology that is not easy to understand. We learned that most of our patients are around Vienna because they can visit us, have a look, and all these kind of things. So then we started to expand to other areas. We tested that kind of late summer last year with 2 centers. And we learned, okay, when they go there, they can sell their own Brainheros directly then. And what we had to do is we had to do some regulatory changes to our system before we can actually do an offer that every kind of little therapy center can offer Brainhero, and they only see their patients. So what it works is every Brainhero partner sells their own patients. And for every patient, we get 150 euros net per month. So there's basically every patient there totally they serve in addition. They get they get actually 350 to 380 euros per month because it's partly funded by youth service or other sources. And basically we get 150 euros per month. So this is kind of how it works. And with every partner we have a kind of an average growth that after 3 months after onboarding, they run about 6 patients, and then they grow by 2-3 patients per month, and probably have a peak at around 12 to 15 for the smaller ones. But there are also larger ones. So we have also a larger clinic in Berlin, for example. Have kind of queued 100 children currently in the treatment of Brainhero. So they're slowly progressing and going into this direction. So this is basically how it works. It's a subscription model. We rent the EEG. So we can produce this whole thing at the moment with 600 euros. So this is the whole package and everything included. So you get there's also an EEG in there. So this is the EEG in there. And we gain per year. In terms of service costs and shipment costs, this is per year around 250 euros. So we have basically first-time cost of 850 euros, but every device creates 1,800 euros per year. And then it's going to be reused. So basically there is a service once a year, each another 250 euros. And the lifetime of this thing is actually, so the box will be replaced, of course, but the lifetime of the EEG is 10 years. So basically it's reused every time, can be reused, and it earns every year 1,200 euros.
And can you also tell us a bit about like what are the plans also moving forward, in the next 18 months in terms of, commercial milestones?
Yeah.
You mentioned some numbers and some targets, but what's the, rationale and the plan behind it?
Yeah. So at the moment we have equipment to build 600 of these devices. So this is kind of the maximum we have at the moment. So the plan is to extend with the existing device to have another 600 or 800 devices, depending on how steep the growth is. We will extend into the UK. So UK is going to be the next market we want to where we want to go into, because autism in the UK is treated very differently. It's also covered by the National Health Services, and they have a real kind of benefit in terms of cost benefit ratio. So because there are There are lots of cases in the UK. There's again the same demand. This is kind of the next rational where we're going. In addition, we have a partner in Ireland where we want to also go because it's already English and we already have the product for that. Nordics is something we want to go country-wise. So these are the interesting areas where we're looking to, where it's easier to go into. Nordics is because is very interesting for us because there is the health system is built on a way that they have a lot of out-of-pocket payments. And they're struggling with autism because it's just absolutely not covered, and the same as with ADHD. So these are the kind of the next markets to go to. In terms of the device, we are working with so we're preparing the next generation. So we actually got an EU grant for actually preparing this that we're closing now at the moment, and this next device will be more scalable. So this is kind of a device at the moment that can be, so actually this 1500 or something that we are producing is kind of the limit. You have to keep in mind that the production facility at the moment is in Vienna. So we have our own production facility where we assemble this and we are refurbishing this. We already have a partner for the next phase, which is in Germany, for the scale up of the medical device hardware. But it needs to be kind of make a bit smaller, more trendy, more cool. And these are the next phases that we want to do. The other thing what we want to do is we want to extend into adulthood. So we need to run some clinical tests for this. We see that the technology is used in other neurological issues, but we want to apply the learning that we have with the older, younger. So we have 16, 17, 18-year-old patients. So we learn from them to go beyond and go into adulthood and see, okay, what can we improve in ADHD? What are the other neurological issues like depression, anxiety that we can really measure and improve? So this is another part where this goes into. And so this is kind of the main focus. We are also thinking of going to the US, but this is something that is, I would not say it's difficult at the moment in terms of politics, so it cannot be really certain. It's also we see that companies from Europe will have more and more issues to go there, so we're not really 100% relying on that. I think the more next interesting market outside of Europe is actually the Middle East. The Middle East have huge autism centers. It's a huge issue, but it's kind of not in the statistics. It's really something that people are afraid of, but the demand is high. We already had requests from the Middle East, and it's regulatory because we also have to deal always with regulatory. Regulatory-wise, the Middle East is for us kind of easy, while with the US, it's very expensive to go through FDA. Of course, the next level of device will have everything prepared to go through FDA, but still just having a device to go through it, but the therapy to go through FDA is another level. So this can really be a beast of hundreds of thousands of euros spending just to have a stake somewhere in the US.
Mm-hmm. And what if you look at the business, moving forward, what is the largest challenge to scaling the business that you're currently seeing?
I would say it's we see that the therapy centers who should actually be using Brainhero are so busy that they have no idea of or they have no time, or they give us time in, we can speak in December, or we can speak very late in the new year, that they're so busy that they don't have a talk with us. So this is kind of one area where we see this is why we're targeting more outside of these centers. So we're targeting learning coaches, we're targeting therapists who are outside of this bubble of being paid by health insurance, because they are really interested and they have usually connection to other reimbursement, which is not health insurance. And this is how we're doing this. And we learned this now over the last couple of months, because initially it would be very simple because everyone would say, okay, go for these autism centers. They're overbooked anyway. And they are for years, but they're kind of, they say, okay, we are doing good business because we are fully booked. So that's kind of the main challenges we see, because we could, in theory, grow quicker by accessing these larger centers. However, we're working on one larger one at the moment. We'll see what happens in the next couple of weeks.
All right. And we're coming to the end of today's session. Like, I wanted what's the main thing that excites you about Brainhero, 5 years in or even more so. And where do you see Brainhero, 2-3 years from now?
All right, the excitement, I think, is for me is almost kind of every day. I have lots of talks with therapists and partners every day. So I'm actually going to a little roadshow in 2 weeks' time across Germany, and I'm seeing lots of therapists, and that's telling, and these therapists are telling their stories, what they're dealing with to children. And I think the most passionate therapists are usually the ones that are affected themselves. So there are actually many who have children with autism and children with ADHD, and it's really heartbreaking, the stories they're telling me and the struggles they have. And we see that we have something that is really, so the symptoms that we can improve is something that we can really make a change in daily life. And we did already for a couple of times. And we had, or even cases when it's not something we have not enough clinical data on this, but we had nonverbal cases who actually were able to name things and became kind of 2-3 sentence kind of verbal, which is really, really cool. It's something that we want to explore more and find really more data on this. And that's the next thing, the data. So we're doing a psychometric test now for every patient. And so we know exactly what is happening over time and what symptoms we can improve. So with this, we learned that typical symptoms like hyperactivity needs a different kind of training, and also the timing of the training. So for example, we learned that that some parents that trained before they went to school. So they did ADHD. So with ADHD, some kids are just, they wake up at 4 a.m. or something. Oh, let's do a Brainhero training. And we learned, no, that has no impact. So, or what we learned also, that if you go below 45 minutes of training per week, no impact. Or if you go beyond, so some parents actually say, let's do more training. Let's do 2-3 hours per week, and then we will be finished in a short time. Then we pay less. No, it didn't work. Actually, much better. You see that the 1 hour, 1 hour 10 at minimum of 3 sessions per week. This is really the way how it works. And I think this data-driven approach is really something exciting. And this brings me to where we stand in 5-6 years. I think in 5-6 years we have cracked this data thing. So we will have thousands of patients. We will have other neurological issues. We can see what training is required to treat what symptom. And I think to enable this, and this is where we're looking at the moment, or started to look already, is we will look and we will need a largest partner to really go into this direction. So we're talking at the moment to some larger clinic groups, for example, who are in the neurological field, who will be kind of the partner where we can really go big. And I think the technology we have, the vision we could have here could be really big.
All right. Well, Christof, Sophia, thank you so much for taking the time. I'd like to take, the chance to also invite the investors that are looking at this to, if you have any follow-up questions, address them directly to Christof or the team, or on the campaign page on SidBlink. They've been nothing but responsive so far. So. And I'm, given the experience that we've had together, I'm sure that, if needed, we could have a follow-up meeting at some point in time. So with this, I want to thank you for taking the time and walking us through, your plans. And I want to wish you a good evening. Thank you. Thank you so much.
Thank you. Thank you. Bye.
Thank you.